Good morning, all. My name is Lisa Owino from Kenya Legal and Ethical Issues Network, KELIN. For physical participants, I hope you still have energy for the meeting considering the traffic. For virtual participants, you're quite lucky to have avoided it. But yeah, so as I said, I work with Kenya Legal and Ethical Issues Network on HIV/AIDS, KELIN, which is a health rights organization working to promote and protect health-related human rights for all. We do this in a number of areas, including sexual and reproductive health and rights, HIV, TB and key populations, health governance, women, land and property rights, and through strategic litigation as well. One of our main methods of working is advocating for rights-based, gender transformative, and people-centered legal and policy environments for health-related human rights, and that's one of the objectives that we hope to contribute to today. So perhaps as actors in the room, both physical and virtual, may know, Kenya is undergoing an epidemiological transition, moving from high burden of communicable diseases like HIV, TB, and malaria to a high burden of non-communicable diseases. I think at last instance, non-communicable diseases represented more than 50% of total hospital admissions and over 55% of hospital deaths. Controlling of non-communicable diseases is becoming even more vital, as we've seen during the COVID pandemic, due to the vulnerability that being or having a non-communicable disease has had on potential COVID patients. And so we're all here today to ask the key question, or to recognize that prevention of non-communicable diseases isn't just dependent on an individual eating healthy and moving more, but an enabling environment where individuals can make healthy lifestyle choices. And today we will focus on the healthy diets aspect. So what is in the Royco we like to eat? What is in that blue band tells our children it makes you taller? Does it make you taller? Is it actually healthy for everyday consumption? And perhaps most importantly, what roles do we all play in ensuring that we actually know what goes into the foods that we are consuming? And so I can see we all have an agenda, and as I said, the objectives of this meeting is first to sensitize all of us and raise all our awareness on the use of nutritional labeling in promoting healthy diets. So again, the recognition that when we drink a bottle of soda, there is no ingredient list and we just assume it's a consumable liquid. We also want to raise awareness amongst all of us on the existing legal and policy framework and the gaps that the gaps in the policy framework, and any recommendations that we may have on enhancing or strengthening our legal and policy environment to promote healthy diets. And so in our agenda, we'll start off with opening remarks from our partners. So they will introduce this project in more detail, but generally this project is connected to a global project on regulatory and fiscal capacity building on promoting healthy diets and physical activities, jointly led by World Health Organization, International Development Law Organization, and International Development Research Center. So they will each have a chance to talk about the global, as we call it, recap program, and give the objectives that each organization is trying to contribute to. After that, we'll have opening remarks from a representative from the Ministry of Health, Director of Nutrition and Dietetics Services. Then go quickly into understanding, while we may all know or assume that unhealthy diets contribute to NCDs, we'll have actual technical experts from the Ministry of Health, the Division of Non-Communicable Diseases, to tell us what is the burden of nutrition-related NCDs in Kenya. From there, we'll move on to a civil society perspective that will cover, again, the burden of nutrition-related NCDs in Kenya and the correlation with the existing burden on communicable diseases. To that, have a brief plenary, maybe go for tea and recharge. When we come back, we'll now learn what does nutritional labeling technically mean. I've mentioned it a couple of times, but do we know what that means from a technical perspective? And so we'll be joined by Kate Robertson from WHO to give us justification for nutritional labeling, and specifically a type of labeling known as front of pack. After that, we'll go into another plenary discussion, have a lunch break to recharge, and then get into the legal and policy framework on nutritional labeling in Kenya. Then talk about what is the rights-based. I mean, as I've said, I'm from a health rights organization, so you will hear the phrase rights-based a lot from me. So yeah, what is the rights-based justification for having policies on nutritional labeling, and then talk about the recommendations that we have, recommended legal and policy actions for a better enabling environment. After that, we shall be joined by the Parliamentary Nutrition Caucus, which I'll give some reflections from its work over the past year or so. After this, we'll have a plenary and have some closing remarks. So I hope we're all quite fired up for this agenda. It is quite interesting and incredibly relevant, I think, to both our to us as individuals or in our personal lives and in our professional lives. So I think we'll give a chance to colleagues just to introduce themselves, and perhaps we can start off with our virtual participants before moving to the physical participants that have joined us here at Sarova. So I think I can just go as per the list of participants on the virtual platform. So Caroline, if you could introduce yourself and perhaps the organization or institution you're affiliated with.
Good morning. Good morning, can you hear me?
Yes, we can, Caroline, very clearly.
My name is Caroline Kasivai from Kenya Bureau of Standards.
Thank you, Caroline. If we could have Grace.
Morning, everyone. My name is Grace Modoni. I work for Ambassadors for Youth and Adolescent Reproductive Health Program. I'm so sorry. I thought the meeting will be tomorrow, so I would have come physically, but now I have to join online.
No problem,
Thank
Grace.
you.
We're just happy to have you in the room. Charles?
So, good morning, everyone. My name is Charles Muya. I work with the Kenya Network of Cancer Organizations, and I'm glad to be here and to learn more. Thank you.
Thank you, Charles. Chidinma?
Good morning, everyone. I am Chidinma Okoko. I work with WHO Afro Regional Office.
Thank you, Chidinma, for joining us. Daisy Jeruto? Daisy, if you're speaking, you're on mute. All right, perhaps she's having a technical issue. So Daisy Lenjo.
Good morning, everyone. My name is Daisy Lenjo from ILA, International Institute for Legislative Affairs, and I'm glad to be here. Thank you.
Thank you, Daisy. Daniel?
Good morning, everyone. I hope you can.
Yes, Daniel, we can hear you.
Yes, my name is Daniel Asha. I work with Consumer Unity and Trust Society in Nairobi. I'm happy to be part of this particular meeting.
Thank you, Daniel. Then just a reminder to all virtual participants, if you're not speaking, kindly ensure that you're on mute. Dennis, the floor is yours. Dennis, if you're speaking, you're still muted.
Representing Ambassadors for Youth and Adolescent Productive Health Program, and I'm happy to be here.
Thank you, Dennis. Happy to have you. Julia.
Good morning, everyone. My name is Julia Zavi from the International Development Law Organization, IDLO. Very nice to meet you and to be here today. Thanks.
Thank you, Julia. Grace Mudhoni. Grace, if you're speaking, you're on mute. All right, other Grace. Grace, I think you had, Grace Mwanye, I think you had a chance to introduce yourself. So we'll move to Hannah.
Good morning, everyone. My name is Hannah Kieri, representing State Department for Industrialization from the Ministry of Industrialization, Trade and Enterprise Development. Happy to be here.
Thank you for joining us, Hannah. Ijeji Alden. If you're speaking, Alden, you're on mute. All right, perhaps a technical issue. Irene.
Good morning, everyone. My name is Irene Kilucci, and I am a Program Associate for IDLO, International Development Law Organization. Thank you.
Thank you, Irene. Jessica. Jessica, if you're speaking, you're on mute. All right, Judith.
Good morning, everyone. My name is Judith Okot from Jomo Kenyatta University of Agriculture and Technology. Glad to be here. Thank you.
Thank you for joining us, Judith. Kate, the floor is yours.
Thanks. Good morning, everyone. My name is Kate Robertson. I'm from WHO headquarters in Geneva, and very happy to be here today. So nice to meet everyone.
Thank you for joining us, Kate. Marcus. Marcus, if you're speaking, you're on mute. All right. Maria.
Good morning, everyone. My name is Maria Juguna. I'm the program coordinator for the Health Law Program in IDLO, the International Development Law Organization. It's good to be here today. Thanks.
Thank you, Maria. Margaret. Margaret, if you're speaking, you're on mute. Right. Marianne.
Good morning, everyone. My name is Marianne Juguna from Narcolepsy African Foundation, and I'm glad to be here.
Thank you, Marianne. Ndegwa. Ndegwa, if you're speaking, you're on mute. All right. Rogers.
Good morning, everyone. I'm Rogers Zucchin from Kenya Union of Nutritionists and Dietitians. I'm glad to be here.
Thank you, Rogers. Samuel?
Good morning, everyone. My name is Sam Uti from Canada's International Development Research Center. I'm a senior program specialist in our Global Health Division, and I sit in our Nairobi office. Thank you.
Thank you, Sam. Simon? Simon, if you're speaking, you're on mute. All right, Veronica, the floor is yours.
Good morning, everyone. Thank you for coming for this meeting. My name is Veronica Krobo, Director of Nutrition and Dietetic Services in the Ministry of Health, and working together with IDRO, IDRC, and WHO in the implementation of RECAP project. Thank you very much and welcome.
Thank you, Veronica, and thank you, virtual participants. I think we can also have a quick round of introductions for the participants who are physically here. You'll see there's a mic in front of you, so just press the on and off button to introduce yourself. I think we can start from the back table over there.
Yes, good morning, everyone. I'm Nicholas Omuono. I work with the State Department of Social Protection, Murang'a County.
Good morning, everyone. My name is Esther Minor. I also work with the Ministry of Labor and Social Protection.
Good morning, everyone. My name is Ansake. I work with NCD Alliance Kenya. I'm glad to be here. Thank you.
Good morning, everyone. My name is Stephen Anguva Chikoli. I'm the National Coordinator Network of TB Champions. I'm also the Director Pamoja TB Group.
Good morning. My name is Elvis Uma. I work for Confraternity of Kenyan Patients, based in an NGO based in Nairobi. I'm here to learn and to network. Thank you.
Good morning, everyone. My name is Ian Mutiso. I am a trained attorney, and I'm also the legal and policy advisor for NCDAC Kenya.
Good morning. My name is Dr. Mary Mwale. I'm from Ministry of Agriculture, Livestock, Fisheries, and Cooperatives. I'm also the chair of the Food Labeling Committee, Technical Committee. Thank you.
Morning, everyone. My name is Peter Odenyo from NEFAC. I sit at the board of TB Champions in Kenya as a treasurer.
Good morning, everyone. My name is Maureen Mukhetha. I work for Global Alliance for Improved Nutrition, and I'm looking forward to interacting with all of you. Thank you.
My name is Chadwick Digo. I work for Egerton University. I teach nutrition and dietetics. Pleasure.
Morning. I'm Joyce Wairimo from Pamoja TB Group as the chair, and I'm glad to be here.
Hi, good morning. I'm Edgar Okoth. I'm the National Coordinator for SAN CSA Scaling Up Nutrition Civil Society Alliance, and also a member of the Global SAN Steering Group.
Okay, thank you all. I think I'll let my two colleagues introduce themselves as well.
Morning, everyone. My name is Jaret Onyego. I'm an advocate of the High Court of Kenya, and I'll be your rapporteur for today.
Good morning, everyone. My name is Timothy Waffula from Kelin, and I'm happy to be here, and welcome to the participants who are joining us virtually and those who are here physically. So thank you.
Okay, thank you all. I think as we can see, there's a very diverse group of stakeholders here, all committed to this cause of promoting healthier diets for the prevention of NCDs. And I think we can see we'll get a variety of perspectives, quite important in anything to do with legal and policy work. So without further ado, I'll invite Julia Zevi from International Development Law Organization, IDLO, to give some opening remarks and introduce the Global Regulatory and Fiscal Capacity Building Program recap. Julia, the floor is yours.
Thank you so much, Liz, and thank you for organizing such important dialogue today. I will be briefly introduce the recap program. As mentioned, I'm Julia Zevi from the International Development Law Organization. For those of you who are not familiar with IDLO, IDLO is an intergovernmental organization exclusively devoted to the promotion of rule of law to advance sustainable development worldwide. We are currently implementing, together with WHO and IDRC, let me share the screen, the Global Regulatory and Fiscal Capacity Building Program to promote healthy diets and physical activity. Liz, I cannot share the screen. Okay, now I can, thanks. So we have a brief presentation that I will be doing together with my colleagues from WHO and IDRC, Kate and Sam. Can you see the screen?
Yes, we can, Julia.
Okay, great. Thank you so much. As mentioned, the Global Recap Program is a global program that started in January 2019, and it's implemented in Tanzania, Kenya, Uganda, Sri Lanka, and Bangladesh, together with the WHO and IDRC, to build the regulatory and fiscal capacity to promote healthy diets and physical activity, mainly on 5 policy areas: restrictions on marketing of foods and non-alcoholic beverages to children, fiscal policies for diet, and in particular SSB taxation, nutrition labeling, including front-of-pack labeling, reformulation of food products to contain less salt, sugar, and fats, and physical activity promotion. The project is comprised by 3 complementary objectives and components, each of them led by a different organization. So we do have the capacity building component led by WHO, the social mobilization component led by IDLO, and the research component led by IDRC. The IDLO component, the social mobilization component, has mainly the objective to facilitate national and international collaboration among policymakers, researchers, civil society actors, and communities to create an enabling regulatory and fiscal environment that promote healthy diets and physical activity. In this framework, we are working mainly on 2 main components. The academic component to integrate regulatory and fiscal issues in legal and public health training curriculum. And for instance, we have established in East Africa a regional academic working group that brings together academics from schools of law and schools of public health to work and to integrate in the teaching courses regulatory and fiscal issues. And we are working with civil society organizations in each of the country, in each of the 5 countries we are working with. And in Kenya, we are working with Kelin in particular to undertake advocacy and awareness raising activities. And it is in this framework that Kelin is organizing together today the sensitization dialogue. So let me give perhaps the floor to Kate to continue the presentation and explain a bit more about the objective one on the capacity building component that is led by WHO, and then to Sam to talk about the research component. Thank you.
Thanks very much, Julia. As Julia mentioned, WHO is the lead agency looking at the capacity building program under Global Recap. So just running through very quickly this list of activities here. And I suppose just to mention, as it states at the top of the slide, the point of the capacity building program is to strengthen the capacity in countries. So to work with experts across a range of government, of civil society, of academia, and experts across public health as well as law and fiscal policy. To assist people to work together to design, implement, and evaluate regulatory and fiscal interventions that are designed to promote healthy diets and to increase physical activity. So the activities that we've been undertaking, initially we undertook a needs assessment in Kenya back in 2019, involving first an external desk review of the relevant regulatory and policy areas, identifying stakeholders, relevant governance tools, mechanisms, gaps, opportunities, that sort of thing. And also following up with a number of stakeholder interviews to get a better feeling for the priorities and what's actually happening in Kenya. Those needs assessments have informed a lot of the subsequent work, including feeding into the training courses that we've delivered. Initially, we held a global training course in 2019, though unfortunately, due to the COVID pandemic, we haven't been able to hold the subsequent global courses that we intended. But we have conducted in-country training, including a training in Kenya in late 2019, which I'm aware a number of you actually attended. We've put together a global roster of experts, which work with us to provide us a number of the training sessions and also, where relevant, technical support. And we're always looking to try and expand that pool of experts, particularly to include experts from each of the participating countries. What we're largely engaged in at the moment is in the provision of technical support. And again, I've had the pleasure of working with a number of you in relation to some of our technical support activities, where we're actually working with countries to try and actually take the findings from the needs assessment and the research that's been done to translate the effect of the training and to really build on the local expertise available to try and actually make progress in interventions in the country toward fiscal policy and regulatory reform in the recap policy areas. And we've certainly made some good progress in Kenya over the last couple of years, which is really pleasing. The final point there, our physical activity teams have been working on developing some background and some technical papers in relation to regulatory and fiscal measures to promote physical activity, less relevant to today's session, but also an interesting development. Julia, would you mind just flicking through to the slide on Objective 3, and then I'll hand over to Sam.
I am trying, Kate. I don't know why it is. Okay, let me go to.
Thanks, Julia. Just to mention, so in activity 3.1, WHO has been undertaking some global systematic evidence reviews of 3 of the policy areas. So looking at fiscal policies to promote healthy diet, looking at marketing restrictions and also nutrition labeling. Those have unfortunately been pushed out a little bit by the pandemic and by the complexity and breadth of the studies. But those are looking to be published toward the end of this year and should be hopefully available then to inform policy work. So I'll stop there and hand over to Sam. Thanks, Julia.
Thank you, Kate. So good morning once again, everyone. So for those who don't know about IDRC, so IDRC is a Canadian Crown Corporation established in 1970. And for the past 50 years, we have been supporting and funding research for development in low and middle income countries on a variety of issues, including global health issues such as non-communicable diseases. And so we are one of the supporting agencies, the partnering agencies for this global recap initiative. And our role is to support the generation of locally relevant evidence that is led by local experts. So experts who have a great understanding of the context. And this is particularly important when we are dealing with regulatory and fiscal policies, such as those that are proposed as part of this initiative, because as some of you might know, some of these policies will not be particularly received well by those whose economic interests might be impacted by the policies. So when we talk about, for example, restriction of marketing of unhealthy food to children, then those that produce unhealthy food are likely to fight back. And so that's why you need rigorous evidence that is locally derived in order to back these policy interventions. So to that end, we ran a competitive call in 2018, and it was across the 5 recap countries. At the end of it, we are supporting 4 projects, one in Sri Lanka, one in Bangladesh, one in Kenya, and then one that is regional that involves Kenya, Tanzania, and Uganda. The one in Kenya is led by the International Institute for Legislative Affairs, and I see they are represented here today. And they are partnering with Kula Vyema Center here in Kenya and with the University of Cape Town. And basically, they are looking at fiscal policies for promoting healthy diets. And in particular, they're doing some modeling work, mathematical modeling, to see what the impact will be of taxation of sugar-sweetened beverages, sodas, and how that will lead to any impact on the levels of obesity and NCDs in Kenya, but also to generate additional revenue for the government. We've seen that work elsewhere. We've had similar success in South Africa, where researchers did a similar mathematical modeling, and that influenced what they're calling the health promotion levy in South Africa. And that has already, since 2018, when it was passed into law by Parliament, has generated around 8 billion rands for the South African government. The expectation was that some of that will go towards health promotion, but obviously that is yet to be seen, but there is still that hope. Then the second project, which, like I said, is regional, is doing 2 things. In Uganda and Tanzania, they are looking at implementing what is known as the Food Epi module, which is a module developed by a network known as Informas. And basically, they are benchmarking the extent to which food environment policies in those 2 countries are being implemented. That has already been done in several countries, including Kenya, and by the same organization, the African Population and Health Research Center. And they found that while Kenya has quite a bit of policies, they are not doing so well in terms of implementation. But in Kenya, the APHRC is also going a bit further to try to measure the level, the extent to which unhealthy food is being marketed to children. So they are looking at billboards, they are watching adverts on TV, they are going to schools and looking at the kinds of advertisements and kiosks that are around the schools and what they're selling, to get a sense of the extent to which our children here in Kenya are being exposed to this unhealthy food. And I just attended a meeting yesterday where they presented some preliminary findings. And not surprisingly, billboards across Nairobi in particular, about 40% of the adverts are unhealthy foods, such as sugar-sweetened beverages. So this should encourage us that we're on the right track in terms of advancing some of these policy interventions, including the one that brings us here this morning, nutrition labeling. And in fact, APHRC has done some synthesis work of global evidence that will inform some kind of labeling, or what we're calling the front of package labeling policy, which is being developed in Kenya, and the hope is that this policy will change the status quo, because right now I'm sure for many of you, where you grab something in the supermarket, the print at the back is so tiny and you can hardly make sense of whether what you've held is, whether what you're buying is healthy or not. So with a proper front of package labeling that is bold, that communicates clearly, we've seen this work successfully in countries like Chile, that would have a situation where we have more information about what we are purchasing off the shelves. We are also doing supporting other complementary activities in Kenya. We supported the Ministry of Health as they finalized and launched the new non-communicable disease strategy 2021 to 2026. Particularly, we assisted in bringing other perspectives which were not initially considered in the policy, including other sectors such as agriculture and gender, which we feel is very important to consider in such policy. So we supported that process. We've supported work in Kenya on looking at the cost of eating healthy versus eating unhealthy, especially in low income areas. And what they found is that in low income areas, the cost of eating healthy is much higher than the cost of eating unhealthy. So purchasing unhealthy food is cheaper than purchasing healthy food. And so that has implications when we do our health promotion and we are asking people in Kibera or other low-income populations that they should try to eat better. We should recognize that there's a cost to that. And it's not as straightforward as just telling them to eat better. We will need some kind of policy interventions to also ensure that healthy food is the easier option. So I'll stop rambling and pass it back to Julia. Thank you very much.
Thank you so much, Sam. Thanks, Kate. And without further ado, over to you again, Lisa, to start today's discussion. Thanks.
Thank you very much, Kate, Sam, and Julia. I think we're starting to see again what we're trying to hammer in today, which is it's beyond individual choices to actually eat healthy and, to live a healthy lifestyle with a good diet or healthy diets and physical activity. I think what Sam has said, we all know, Kenyan colleagues, the chipo mwitu and the smoky pasuas might be much cheaper to get, perhaps in low-income areas or in Kibera, than buying fresh tomatoes and fresh organic vegetables and meats. And so we're starting to see some of these other environmental, systematic, legal, and policy factors that actually contribute to people living unhealthier lifestyles, cost being just one of the many. So I'll invite Veronica to give some opening remarks from the Ministry of Health, a critical partner in the Global Recap Program. Veronica, over to you.
Thank you very much, participants who are physical at Pan-African and also the ones who are joining virtually. It's actually a great pleasure for me to be here and also to listening to what Kate, Sam, and Julia have presented. It just means that we need this concerted effort in order to promote healthy diet and reduce the trend we are having, especially in Kenya, of rising burden of non-communicable diseases. When you look at Kenya, we are talking about a triple burden of malnutrition. We are having coexistence of overnutrition, undernutrition, and micronutrient deficiencies. And when you look at overnutrition, and that's why especially the RECAP project is targeting, you find people are consuming unhealthy diets. We are having about 78% of children under 5 years consuming what we call they can't meet the minimum acceptable diet. So what are they consuming? Oti presented about the influence of a billboard. Yeah, everybody want to go for high fat. They are sweet, yes, sweet food. Want to go for high sugar beverages. And what does that mean to the nutrition status of especially children and when they grow to adult? That means they are more at risk to non-communicable diseases, increased healthcare costs, and then it becomes very difficult for a government to meet even the universal health coverage. And that's why for the Ministry of Health, we embraced the RECAP project because as you have heard, the goal is actually to promote healthy diets. And for Kenya, we have quite a number of policies, be it even at the registrations and policy document that we can anchor this promotion. And I like the question, why then are we not able to change this situation? Our very own constitution, Article 43, 53, 46, is talking all about healthy diet, consumers' right to the information and to health for the health to be protected, and therefore protecting people from unhealthy diet become a very critical agenda. When you look at the several acts, starting from the Health Act, Children's Act, Breast Milk Substitute Act, Food, Drug, Chemical Substance Act, Public Health Act, Consumer Protection Act, name it. We all now need to just see what is it that we are not doing right, and that's why with the IDLO, with the IDRC, we'll be able to get what are the gaps either in the policy or in the legal instrument that we need to fasten so that we can be able to promote healthy diet for our people in Kenya. As a ministry, we are having quite a number of interventions that are spelled out in the Kenya Nutrition Action Plan, in the just recently launched non-communicable disease strategy. And therefore, in terms of interventions, priority interventions are there. And for today, we are talking about nutrition labeling. When you look at our Kenya Nutrition Action Plan, actually, we are purposing to restrict marketing of unhealthy food to children. And one of the tools we wanted to use also is also the nutrition labeling, so that people are able to get information about the nutrient value of products that we are consuming. We also have a national guidelines for healthy diets and physical activity. We recently did incorporate food and nutrition content into the revised school curriculum because we want, at the very young age, children should know what is healthy diet, what food groups should they consume, how much, and that's content we have been able to include it in the school curriculum. We have finalized a developing of a teacher reference manual, which will be disseminating later on. We also having other interventions like the micronutrient supplementation. But you can imagine if Kenyans were consuming healthy foods, healthy diets, then we may not need to go for mass micronutrient supplementation, like the case we have for vitamin A supplementation and iron and folate supplementation among pregnant women. We also have food fortification, mandatory food fortification for packaged wheat and maize flour, and also vegetable cooking oils and fat to put in the essential micronutrients that our population need. Looking at the whole arena of nutrition, we also work with other sector like Ministry of Agriculture. Recently the ministry launched the 4K Club, and we want to also be able to use that vehicle to promote healthy eating from at the primary school. The Ministry of Agriculture also last year they launched an initiative, 1 million kitchen garden initiative, and this is aimed to improve the access to micronutrient-rich foods to homes. With the Ministry of Education, we have the school meal and nutrition strategy, and this, spells out the need for having nutritious school meal to the school children, not just for school performance, but also for health and nutrition well-being for those children. We also have other activities at the water, sanitation and hygiene, which is also part of a key resort area in our Kenya Nutrition Action Plan. And with the social protection, we are also promoting a project which we are calling Nutrition Improvement Through Cash and Health Education. Because these vulnerable households who are receiving cash transfer, they have children, they have pregnant and women and lactating women. How can this cash they are receiving be used using a nutrition lens for them to be able to provide healthy diets to their family? That's a project that we are doing with the social protection. Let me take this opportunity to sincerely thank the World Health Organization, IDLO, IDRC for partnering with the ministry to implement this recap project, which is being implemented in other 4 countries. And we are hoping that as we come to the end, we'll have good recommendations that can influence our policy, our fiscal policies, our general policies, our legal instrument, so that Kenyans can be able to get or access healthy foods without influence of advertisement, without influence of nutrition labeling. And therefore, for today's meeting, which is to sensitize stakeholder and also create awareness on the policy tool of nutrition labeling, it is very important that as all stakeholders, we understand why is it we are doing this. I know Immaculate, my colleague Immaculate, will be able to share with you how far we have gone as a ministry in providing the guidance on front of pack labeling, because it's important that when you are buying a product, it is clear for you that this product contains A, B, C, D. Is it on the healthy threshold or not? Then you can make informed decision. Ladies and gentlemen, I wouldn't want to take more time because the agenda is long, but I sincerely thank you for attending. I am praying that you be very attentive, very productive, because we are doing this for our country, Kenya, what is good in terms of moving the healthy diet agenda forward. And with those remarks, I wish to declare the forum officially open. Thank you very much, and God bless you.
Thank you very much, Veronica. I think you can see from Veronica's presentation and from her remarks the multiplicity of actors and institutions that need to be involved for one individual to be able to make healthier lifestyle choices. I think Veronica touched on restrictions on marketing, and I'm just imagining, we can see, so in fact, if the cost barrier were put aside, even if I were able to actually afford healthy food, but I have tiny children, and then we enter a mall, and the first sign we see is kids under 5 eat free at Domino's. I can't even use the excuse of hakuna pesa or there's no money for pizza, because Domino's has declared in large font that if you're under 5, you can eat free. I even remember this very funny situation in the supermarket, and someone told me it's actually a ploy by supermarkets to put sweets and chocolates right at the counter, so that if they don't have change, or if you're tired, you just slide one past. And I remember this mother had completely refused to buy her child chocolate, and every time she turned to look at the cashier, the child would slip the chocolate through. She removes it and puts it back. As she's standing to put it back, they have taken gum from the bottom counter and tried to slip it through. It was quite funny in the moment, but in context, it just goes to show how hard it can be as an individual to facilitate healthier lifestyle choices, not just for yourself, but for your family. So I'd like to invite, as Veronica has officially opened our agenda now, I'd like to invite Zakaria Ndegwa Muriuki from the Ministry of Health, the Division of Non-Communicable Diseases, to actually talk about the burden of nutrition-related non-communicable diseases in Kenya. Zakaria, the floor is yours.
Okay, thank you so much. Good morning, everyone. Sorry, I was not able to join physically. I'll be joining virtually. I'm in Nakuru. My name is Zakaria Ndegwa Muriuki from the Department of Non-Communicable Disease, Ministry of Health. And I'll be giving an overview of NCDs and the diet-related NCDs in Kenya. So I'll be sharing my slides, and I'll also put my video off. Okay, I hope you're able to see my slide. I'll give Thank you so much. So I will start with, first of all, asking ourselves why NCDs? And one of the reasons we are discussing the NCDs is that NCDs are responsible for 71% of deaths globally. That's it, 41 million people died. And it's also the second leading cause of morbidity and mortality in Kenya. And this is after communicable diseases. And that 50% of hospitals admissions in Kenya are because of NCDs. If you walk to a hospital in Kenya right now, 50% of the people admitted in those hospitals is because of an NCD. NCDs also cause about 54% of what we call DALYs. That is disability adjusted life years for those people who are less than 40 years, meaning that the people are below 40 years won't hit 70 years because of an NCD. And also they will have what we call catastrophic out-of-pocket expenditure. And also their lifespan is cut short because of an NCD. And then by 2019, we had about 39% of deaths occurring in Kenya because of an NCD, meaning that this is the right time for us to talk about prevention of NCDs, or what we are calling our national strategy, halting and reversing the rising burden of non-communicable diseases. In terms of targets, Kenya is on course in meeting the targets for nutrition and NCDs. For example, we're in course in meeting infant inclusive breastfeeding. At the 5 stunting, we're on course in meeting that. At the 5 wasting, and at the 5 overweight and obesity, meaning that those particular targets, we are on course in meeting those targets. Of course, because of the interventions that have been put in place by the partners and also the Ministry of Health to address this particular cohort of the population. But when it comes to the adult population, we are not meeting those targets. Anemia in women, low birth weight, diabetes and hypertension prevalence, and also obesity in both adulthood and childhood. We are not, for 5 years and above, we are not on course in meeting those particular targets, meaning that Kenya is still grappling with the double burden of malnutrition, both overweight and also underweight. This is the same presentation. This is from the Global Nutrition Report 2019, and you can see the targets. For example, for the 5 stunting, you're on course, wasting, you're on course, or what I've already said. But you can see, for example, for adult obesity, there's no progress, or we are worsening in terms of meeting our targets. More and more men are becoming overweight and obese. The same with the women. More and more women are becoming obese, overweight, and you're not meeting the target. And the same for diabetes, and also anemia in women of the reproductive age. So we need to do something. If you are for us to halt and reverse this rising burden of NCDs, we need to do something about these diseases. What about the risk factors for disability and mortality for NCDs? If you compare 2009 and 2019, you can see, for example, NCDs, for example, high blood pressure was number 5 in 2009, still remains at number 5 as one of the leading causes of morbidity and mortality in Kenya. You can also see, for example, the high body mass index moved from number 10 to number 7 in 2019, meaning that this is what this cause of morbidity and mortality about the high body mass index or overweight is increasing in this country. The high fasting plasma glucose also moved from number 11 to number 8. And you can see, for example, out of the 10 leading causes, NCDs and dietary risk factors are more than 5. You have tobacco, you have dietary risk factors, you have high fasting plasma glucose, high body mass index, alcohol use, high blood pressure. Actually, more than 70% of the risk factors in Kenya are because of non-communicable disease. And this is because this is as per the Global Burden of Disease 2019. As you see, for example, the childhood obesity for both boys and girls, you can see the numbers, the prevalence is still increasing. You can see, for example, for the female, it increased from 7.5 to 16.2%, and also for the males between 2.3 to 6.2% within the same report, Global Nutritional Report 2019. This is overweight, and the other one is obesity. None of them, meaning that something has to be done. If, for example, you have to put policies in place that can help us to address marketing of sugar-sweetened beverages to our children, or marketing of unhealthy foods to our children. For example, you go and see the Terrific Tuesdays posters being placed near schools. And when a child is coming out of school, or for example, on Saturdays, you see parents queuing to buy these foods in KFCs and other food outlets. Because these adverts have been made throughout the week, the message has been reinforced in the mind of a child all the week that having a pizza is a healthy way of, or having the chicken bucket is a healthy way of eating. But you can see the impact of that particular advertisement by the food producers. I move to the next one. Most of us talk about obesity as genetics only, but you can see the biggest contributor of obesity as a risk factor is lack of physical activity, sedentary lifestyle, meaning that somebody is sitting down throughout the day. That's what is called sedentary lifestyle. Your work involves sitting down the whole day, for example, in an office, or for example, our children are always in school the whole day, they are sitting, then they come in the evening, they sit again to do the whole homework, then they sit down to watch TV on physical activity on times that we are supposed to expose our children on screen. And it's amazing if you are going to read those guidelines. They are saying any child below 2 years should not be exposed to a screen. And any child between 2 to 5 hours should have less than 1 hour of screen time per day. But in this country, our children, they come back home, they watch TV. So they have a lot of unhealthy, sedentary lifestyle. And then that coupled to unhealthy diet. So the first 3 factors contribute a lot to obesity, more than genetics and environment. So we have to do something around the 3 risk contributing factors for obesity. So what are there are several factors, and the biggest one is what we call government policies and regulations. For example, do you have consumer protection policies? Have we put what we call watershed hours, whereby advertisements can be made for unhealthy products, alcohol, unhealthy foods, Coca-Cola, and all that? Do we have such policies in Kenya? What about front of package labeling? Right now, Kenya has what is called back of package labeling. The print are small. Some of the things are not substantial. The claims are not factual. So we need to put policies around that so that these policies can help reduce these factors for NCDs. What about agriculture policies and subsidies? Do you have policies that addresses production of healthy foods? Our people, our farmers, are they producing healthy foods? Are they available in the market? What about price and taxation measures? Are we taxing unhealthy products? The sugar-sweetened beverages, the high in fat products, are they taxed so that once we increase the tax of these unhealthy products, the consumption of those products comes down? What about transportation policies? If somebody is transporting healthy foods, let's say from Kinangop to Nairobi, or let's say from Nakuru to Nairobi, do they have, for example, subsidies for people transporting healthy products to the market, or they pay the same with somebody transporting Coca-Cola or any other unhealthy product? What about urban planning policies? Do you have places for physical activity? Do you have walkways? Do you have cycling lanes in our facility? As we are developing, for example, we have now developing the Nairobi Expressway. Are we putting in place a place for cycling? I'm sure that's not being put in place. Then we can have, then the next driver is what is called social drivers. Urbanization is the biggest social driver in this country. By 2030, more than 50% of Kenyans will be living in what is called urban centers or some form of urban centers. Even in our local rural areas right now, we are having what is called urbanization in the rural areas. There's motorized transport because of the motorbikes. There's availability of electricity, water at home. So meaning that the practices of urban areas are now catching up with our rural areas. Decreased physical activity at work and at home. And I said this before, that people are not becoming active at home or at work. Less time to prepare food. Right now, because of the advent of, for example, COVID-19, we are always in the virtual meetings, meaning that, or in hotels. So meaning that 1 or 2 meals in a day is going to be eaten outside home. Probably breakfast is the only meal that you are going to eat at home. The rest of the meals you are going to eat from outside from your home. Is that particular food, is it healthy? What about affordability of fresh foods in urban areas? Is it affordable? If I was to go to in the middle of town right now and I want to have lunch, what is more affordable? Is it unhealthy food or healthy food? And then the junk food outlets are now available in our malls and estates, very, very common. What about the food supply? Industrialization and agriculture processing. When you talk about taxation, the manufacturers are going to tell us, how are you stifling the production of products? And we are paying taxes. And the government wants to pay taxes or wants to make money from taxes on one hand. The other hand, we want to protect the health of the population. What about having more processed food that have long shelf life? That's another determinant of NCDs in this country. And then we're also having more aggressive marketing and promotion, particularly to children, by the manufacturers. Sorry, let me move to the next slide. So what is the prevalence of selected NCDs? In Kenya, for example, you have percent, and then what is called pre-diabetes at 3%, and this is as per the STEP survey 2015. Cardiovascular disease was at 9%, and then hypertension leading this particular cohort with 24%, meaning that 1 out of every 4 Kenyan is living with hypertension, and some of them have not even been diagnosed. And then the cardiovascular diseases are the second leading causes of death in Kenya. Cancer, we have about 9% of the population living with cancer in this country. What about the risk factors? I've already talked about these factors, so I just mentioned. For example, overweight and obesity. About 27% of the population are living with overweight and obesity, with men having about 17.5% and women having about 30% of overweight and obesity in this country. And healthy diet, only 94% of Kenyans consume enough fruits and vegetables. WHO recommends about 5 servings of fruits and vegetables per day, and 1 serving is about 100 grams of fruits or vegetables. But in 2015 survey, only 6% of Kenyans had adequate consumption of fruit and vegetables. Another 23% of Kenyans were adding salt or salt sauces to their foods before consuming those foods. And another 84% of Kenyans were adding sugar to their food or beverages before consumption, meaning that Kenyans are consuming more and more calories from foods, from what we call hidden sources of calories, added sugar or sugar-sweetened beverages. When it comes to tobacco use, about 13% of Kenyans were active consumers or smokers, and then men having more, leading that part 23%. Something that was very, very sad is that about 24% of Kenyans were exposed to what is called secondary smoke at home. I smoke at home, my family is exposed. 24%, a quarter, meaning that in as much as you have put policies in place, we have Tobacco Control Act, we have some enforcement of this particular act. Unfortunately, Kenyans are still exposed either at work or at home. And then we had about 12% of Kenyans having what we call heavy episodic drinking. And then 35% of Kenya were drinking what is called unrecorded alcohol, the changa, the busa, which was not recorded. We didn't know the amount of the alcohol in that particular drink. We asked Kenyans about their perceptions of salt consumed, and majority of them said they felt that they were just consuming the right amount of salt. but about 10% said that they consume too much salt in their diet. We also asked them about sugar, and about 63% told us they are consuming about the right amount of sugar in their diet. But remember, 84% were still adding sugar to their beverages or foods before consuming those foods. We also asked them about those Kenyans who are controlling their intake of sugar by reduction of sugar-sweetened beverages per day. And you can see only about 50% said that they have reduced consumption of, let's say, sodas or juices, those drinks, only 50% of them. The rest of the Kenyans who are consuming sugar-sweetened beverages, don't thinking about the impact of those sugars into their diet or into their overall health. We also asked them about the type of oil they were using to cook at home, and you can see about 38% of Kenyans are still using vegetable fat. And most of these vegetable fats are made from what we call trans fats. So we still have a big challenge of a big population consuming vegetable fat in Kenya. Something that was very amazing in this particular survey, we asked Kenyans about lifestyle advice or health lifestyle advice by a professional healthcare provider. And you can see none of those risk factors, Kenyans reported that they were being advised was above 50%. For example, how to maintain a healthy body weight. Only 11% of Kenyans said that they receive these messages that they need to maintain their healthy body weight from a professional healthcare provider. Physical activity, 11.9%, fruits and vegetables, 20%, salt reduction, 10%, alcohol, 9%, and tobacco use, 8.3%. So healthcare workers need to be empowered, need to be trained on how to communicate to the population on reduction of the risk factors. In as much as you're thinking about policies, we need to think about how do we empower the population? How do we do consumer education as part of the policies to strengthen or to halt and reduce the rising burden of non-communicable diseases in Kenya? Okay, what about the national policies that are available in Kenya? Fortunately, Kenya has a mandatory registration on salt iodization. This is available. All our salts are iodized. On healthy diet and physical activity, we have national strategies on NCD. The current one we launched like 2 months ago, 2021-2025. We also have a nutrition action plan 2018-2022. And I would like to see probably by the end of 2022, how much of that strategy has been implemented, because it's almost coming to an end. What about the front of package labeling? We are at the development. We have made some milestone in this particular area, but it's still not been implemented. We are still having what is called back of package labeling. What about policies on salt consumption? This is not available. We did one in 2015. Unfortunately, didn't have a threshold, didn't have enforcement measures. It was just an act of, it was from the National Assembly, but it didn't have a threshold on reduction on salt and what you need to do. The threshold need to be set for the manufacturers to say that we are reducing salt. What about policies on marketing of unhealthy foods to children? It is not available. And marketing to limit saturated fat, also not available. And sugar-sweetened beverage tax is also not available. So all of these are things that we need to think about. And I know we are doing a project called RECAP. We are carrying as part of this particular project, but this project was to empower or build the capacity of the policy makers on how to develop these policies and enforce the policies at a country level. So as I end my presentation, I want to ask us this particular question. If, for example, in your house, you have a tap that is run, you have a running tap or a leaking tap, which would be the easiest thing to do? Is it to go and repair the tap, or is it to employ people to keep mopping the floor? Unfortunately, in Kenya, this is what we are doing in NCDs. We are treating NCDs one by one. We are sitting pretty in our facilities, in our hospitals, waiting for people to come with a high blood pressure, high blood sugar, a cancer. We keep mopping, but we are not going back to where the source, the primary source is for this particular or addressing the risk factors. And some of that intervention that we need to do is have policies that can help Kenya to prevent or to reduce or reverse the rising burden of non-communicable diseases. So as I leave this particular meeting, I want to ask yourself, are you a tap turner or a floor mopper? We need to look at the big picture. Thank you so much.
Thank you very much, Edgar, or rather Zachariah, sorry. I think that tap turner or floor mopper metaphor or analogy is a very good one. I think we see that in general in Kenya a lot. And I think, Zachariah, you've already pointed out some of the issues that we see in terms of policies and planning. An entire Nairobi expressway is currently taking us through a lot of emotional turmoil, but does that expressway have room for cyclists? Does it have room for pedestrians? I can say in my own residential area, people cannot take a run or even a walk around because anywhere that there's a pavement for pedestrians, the containers for kiosks and shops have taken up all that space. So you either run on the road and risk being hit, as we know happens a lot with cyclists, or you continue on with your sedentary lifestyle. And so quite interesting to see that even tobacco has moved from number 10 as a risk factor, or number 8 as a risk factor in 2009 to number 10 in 2019. Whether there's a correlation with the more stringent tobacco policies in terms of how, that picture that we see on the top of a cigarette pack of the diseased lungs, whether there's a correlation, we don't know, but one can hope. And so seeing how, I think we can all agree, perhaps we may have underestimated the level of the level that unhealthy diets or micronutrient deficiencies, sedentary lifestyles, and lack of physical activity actually contribute to public health burdens. So thinking about how we spend more and more, we are spending all day on our laptops, especially as noted during the COVID situation where there's virtual meeting after virtual meeting after virtual meeting. There is a lot more access to unhealthy food. I can tell you, while there's a curfew until 10, Jumia Food and Glovo riders will deliver to you KFC after 10 p.m. You'll not be able to get a tomato to cook food in your house, but you will get the Wingman combo from KFC after 10 p.m. And so continuing to see, and just as Zachariah has rightly pointed out, government policies, implementation, and social drivers play a huge and critical role in ensuring healthier lifestyles. So I was even quite interested in the issue, even the difference again on Kenyans' own perception and the reality, how 63% of Kenyans felt they were consuming an adequate or healthy amount of sugar, when in reality 84% are constantly adding sugar to food and food prepared at home. So in fact, even for all of us within the room, physically and virtually, do we think that we consume a healthy amount of sugar? Like, what's our own perceptions of those 1, 2, 3 teaspoons that we put in our morning tea or our morning coffee, that afia juice that we take, that we think is better than soda because it's a fruit juice? Like, does it actually have less sugar than Coke would? And so, again, continuing to see the actual reality in terms of the burden that NCD and NCD risk factors have on Kenyans and the Kenyan health system. So thank you very much, Zachariah. If you have any questions around his presentation, kindly just note them down in the chat. We'll have a plenary right after this. But for now, I'd like to welcome Edgar Okoth from SAN CSA, Scaling Up Nutrition, Civil Society Alliance, to talk about the burden of nutrition-related NCDs from a civil society perspective. Welcome, Edgar.
Good morning, everyone. Good morning. Are we suffering from NCDs? Okay, let us look at our tables first of all. What is in front of you? Yeah? Sweets. Yeah? Is it something that will predispose you to having NCDs one time or the other? Yeah, so I think before we talk about the causes and the prevention of NCDs, I think we need to start from where we are seated. Eh? And I can see my friend is already eating a sweet. Yeah, so I'm Edgar Okoth. I'm the National Coordinator for Scaling Up Nutrition, Civil Society Alliance. And I must confess that when I was invited to come and speak on the burden of nutrition-related NCDs in Kenya, I was really excited. Eh? But then I read civil society perspective. Eh? Then it took me 2 days to be able to say, okay, so what exactly can I talk about in terms of giving it a civil society perspective? Eh? And I know Zachariah has also put it very well. Are we tap turners or are we floor moppers? Eh? So that's now the civil society perspective. Eh? We are at both ends. Eh? And I'll show you why I say that we are at both ends. Eh? So to start off, there are 3 things that I'll want us, before we leave this place, at least we'll have gotten it. Eh? One is that Kenya is among the 7 countries in the world that suffer the triple burden of malnutrition. Eh? So that means that in the same household, you'll get an undernourished individual, you'll get an overnourished individual, and then you'll get an individual that is suffering from micronutrient deficiency, something we call hidden hunger. So that's number 1. The second one I'll tell you as we go along the way, and I'll be able to ask you questions in terms of the 3 things that you've come up with. So today I'm just going to talk about the burden of nutrition-related NCDs in Kenya, and then I'm going to give it a civil society perspective. But then before that, please allow me just to tell you who we are. I'll take just a minute to just tell you who we are. So the SUN CSA was established in 2013, and the major role was to be able to mobilize CSOs to champion scaling up nutrition in Kenya. So currently we have 17 devolved chapters. So the chapters are in the counties. So you'll see the ones that are shaded for the purpose of this meeting, that is green. So the ones shaded in green, that's where we have active running chapters, meaning that we have coordination in those levels. But we also cover 47 counties. So the SUN CSA is in all the 47 counties, meaning that you'll find our membership in those counties. Currently, we have 70 civil society organizations, and I can see some of them here. Some of them are joining us virtually. But also, we have a youth chapter, because we also realize that for interventions, for the things that we do, we also need to have the youth, because we cannot discuss issues of the youth without the youth. So they must be able to be part and parcel of the conversation, but also in terms of coming up with those game-changing solutions that can address their issues. So for us, we work on 3 majorly strategic issues. So one of them is advocacy on nutrition, both at national. Now we have the regional economic blocks, and also now at the county level. So we work at those 3 levels. And then the second thing that we do is in terms of learning, communication, and also information sharing. And then the last one, which is really critical, is in terms of institutional strengthening and capacity building. Next. Yes, so Zachariah has given us the country perspective, but then for me, I just want to just jump some 2 steps back and give us a little bit of the global perspective, because it has got a lot of bearing in terms of how we as civil societies actually look at the burden of NCDs. So, and this is the second thing that I want you to come up with, get out of this, is that 41 million people die because of preventable NCDs. So in Kenya, we are around 50 million. And you can imagine if we are losing 98% of Kenya on an annual basis. So how many Kenyans do you think we've lost since 2013? How many? Around 7, So that means we've lost 7 generations, Yeah. So that's how how big it is, and I think that's a message that we need to be able to take up. And welcome, Mheshimiwa. Yeah, because I know this is something that is at the heart of what you do, and I know how passionate you are in terms of the NCDs. So you can imagine we are losing 98% of Kenyan population on an annual basis, just because of NCDs. Yeah? And there are things that we can actually prevent. Yeah? So losing generations and generations because of this. But then the other critical thing is that more than 90% of these premature NCDs occur in the low-income countries, and I know Kenya is one of these countries, and they can actually be prevented. You know, that is what really needs to hurt us most. That we are losing 98% of Kenya on an annual basis, but we can prevent this. Yeah. And you know, you start with the small steps. You start with not taking sweets, so that when now we organize, Mheshimiwa, have taken that your challenge here. Yeah? So that these sweets, instead of having sweets, we have something that is much more healthier, something that can have nutritive value. Those are the small steps that we take. And the hotel will also emulate that. And they'll ask themselves, why is it that when, Kellen, why is it that when these guys organize for this meeting, they say that no sweets. Instead of sweets, have this. Those are the small steps that we take. And then we are able to walk that path because we say, let us prevent it. Let us either be tap turners or floor moppers. Where are we? Because sometimes you'll say that as a tap turner, let us be the legislative wing, which is not true. It is us. How then do we start? So that's where now we need to start. So that's now the second thing that you need to know. Next. Yes, so this just gives us, can't hear? Okay, this just gives us just a little bit on the classification that I saw, and I love this in terms of the NCDs in Kenya, and you can see we have diabetes, which is nutrition related, we have cancer, which is also nutrition, not 100% nutrition related, but nutrition related. We have malnutrition, where we have the 3 levels, and then we have the respiratory diseases, and then the cardiovascular, and then the mental health. And when I talked to a friend of mine, told him that, you know, mental health is also an NCD, and they were wondering, no, that can't be. But I think this gives us a very good classification in terms of the NCDs that actually we have in Kenya, that we can actually use in terms of sensitization, because when it comes to sensitization, when it comes to talking about the NCDs, I think this can be a one-page thing that you can use in terms of talking to the general population. Next. So then, what is now then the role of the civil societies in terms of prevention, control, but also treatment of NCDs? So for us, we have 3 major roles that we play. That's why I say that, you see, we are both tap turners and also floor moppers. So one is in terms of advocacy, and I'll be able to talk about more about the advocacy perspective. And then the other one is in terms of playing the watchdog role, or holding the government accountable, and that's why we are the civil society. So that's what we are majorly known for. And then the third one is in terms of direct provision of NCD services. So that's also something that a number of our members actually do across the country at the regional level, but also at global level. Next. So let's look at the role of the civil society in terms of advocacy. We don't just do our advocacy in a vacuum. Yeah? We just don't do it in a vacuum, because one of the things that will ensure that we perform at our best is when we have functioning systems, and majorly in terms of the public sector, but also looking at in terms of the health system, because then also you need people that you are actually doing this advocacy to, yeah? Because we just don't do advocacy to ourselves. We don't talk to ourselves. We make sure that there are people that we can talk to, there are systems that are in place that can actually implement some of the suggestions that we do And I think I want to debunk one of the myths that civil society like making a lot of noise and just running helter-skelter. For us, within the health sector, we work with a system. We work with the duty bearers, so that we are able to identify where there are gaps, we are able to identify where there are solutions. But above all, we provide, we are there in terms of implementing these solutions. So we are, in terms of, when you look at, I can call it in terms of the solution chain. We look at identification, providing solutions, but also being in terms of how we implement. That's why we flourish where there are working systems, where there are working modalities in the public sectors. So for us, our work is actually borrowed much more, and we align ourselves at the global level. We see what is the global outlook of what we do, and then we take that to the national level, and that we call, some people call it contextualization, and in Kenya now you contextualize things twice, or maybe now thrice, because then now you have to contextualize it at the national level. Again, now you contextualize it at the economic block level, and then now you further now contextualize it now to be at now the county level, because again, solutions that we come up with are things that need to respond to the needs. Yeah? We just don't take something and then you say, now, this is your solution, and then let's see how it works. So for us, in terms of our advocacy approach, and that's why I say it has to respond. So for us, it actually needs to stimulate what we call public interest. And then for this case now, we're looking at the NCDs, and now looking at, again, now, what are now the grassroots. And so there are a few things that I also want to talk about in terms of how we actually influence this work that we do. And one of them is in terms of sustaining advocacy efforts and regulations of unhealthy sweeteners. So that is just an example of what we can actually do. And also stimulating national conversation on food safety. So just as I said, in terms of how we have a conversation at the national level, at the regional, and also at the county level. Next. Yes, so what is now our role in terms of being the watchdog? And this is what I call in terms of accountability, and not just to the government, but then also we are working to the other stakeholders, because I know sometimes we forget that we only need to hold the government accountable. We also need to hold ourselves accountable in terms of what are some of the things that we've said that we are going to do. So as civil society, we play a watchdog role to ensure the global, regional, and national commitments are met. Zakaria presented in terms of what are some of the goals that we have in terms of eliminating NCDs in Kenya, but also at the global level. And Kenya has actually signed to these commitments at the global level, but also in terms of the continental level. So our role is to be able to pick that and be able to continuously ask those questions. And we put pressure on government and other stakeholders to ensure that the goals, the targets, and the indicators are actually met. And sometimes when we ask some of these difficult questions, because we are the only ones who can ask those difficult questions and agree to suffer the repercussions. And the beautiful thing about it is that we just don't think about ourselves, but then we look at if the government was signing to these commitments, was there an indication that they were going to be met? Because sometimes we sign so that we look good, so that we say, yes, Kenya has signed to these commitments. So it is now our role to break those commitments down, because we need to break them down, so that we can look at the goal, we can look at the target, we can look at the milestones, because the milestones are very critical, because the milestones is what will give you the opportunity to ask a question, because you said that between this period and this period, this will have been done. So that's our role, to be able to do this. And for us as the Sun CSA, we've established particular structures that I can say that we can use for doing this, because sometimes we do this using proxies. So part of what we've established is the Parliamentary Caucus for Nutrition. Now, the Parliamentary Caucus for Nutrition, of which Honorable Passaris is a member, and also the chair of the Health Committee is also a member of that Parliamentary Caucus for Nutrition, is to be able to give us a voice in Parliament. Because for us, we can't storm in Parliament and be able to ask some of those questions. But then when we have a caucus in Parliament, when we have a committee in Parliament, then they are able to ask those questions on our behalf. So already we've established that caucus in Parliament, and it's up and running. And last week, I think 2 weeks ago, we were with them in Mombasa, just taking them through part of this and also giving them the questions that we needed them to ask in Parliament, but also discussing issues of NCDs. And that's why Honorable Pasari is here today. And we also have got a structure that now we've also signed an agreement with the County First Ladies Association. This is a very powerful outfit. These are the spouses of the presidents at that local level. And they're very powerful in terms of being able to mobilize grassroots. Yeah? So that outfit is also an outfit that we use. And this is in terms of just ensuring that there is social accountability at that level, so that at least we build it from ground going up. We also have got media. Yeah? And you've seen a lot of our members now we've now opened up that media space. And we have our media champions that also provide us with these opportunities to be able to spotlight some of these issues. So that if we say that we are losing 98% of Kenya on an annual basis, then they need to spotlight that and pick it and be able to ask the relevant question and keep on asking the relevant question. And then the last one that we actually now use as an outfit is in terms of working with the private sector. Because they are the ones, I mean, we've been talking about them, and there's a confession. You normally receive, you call it what wing at past 10. It's the private sector that actually do that. And we have the Sun Business Network. And if at all we don't talk to the private sector, you know, we don't need to shout at them. We need to bring them on board. Yeah? And that's what we do as Sun CSA. We've brought them on board. And we have a network where we have the private sector and we're able to talk to them so that they understand our language, so that we understand their language, so that when we propose something, then it's something that they don't fight. Because if you propose that you want to tax their products, they'll fight you. But if they understand why that tax needs to be done, then we don't even need the tax. We just need them to remove those things. We need the front labeling. I mean, we talk as colleagues and they actually understand this. And that's the kind of advocacy that we actually do. And now we brought them on board. The only time that now we now tell them, now you can leave the table, is when now they don't want to do what we want. And Charles here through GAIN, they actually coordinate the Sun business and bring in the private sector on board to be able to have that conversation. Next. Yes, and I think this is now my last slide or so. And this is now bringing me to the last thing in terms of us being the floor moppers, in terms of the role in direct provision of NCD services. So quite a number of our members, and this is both international organizations that we have, of which I know NCD Alliance is a civil society, and they do that. And then we also have got the local-based organizations and also community-based organizations that are directly involved in providing treatment. They're also involved in community sensitization related directly to the NCDs. They're also involved in terms of the referral system. They're also involved in terms of the procurement of the products that are required for the NCDs. And that's why I say we actually are on both aspects of prevention, control, and treatment of NCDs. And that's why for me I was really excited in terms of being part of this process so that we're able to chart our way forward. I think that marks the end of my presentation, and I'm really grateful that I was invited for this occasion. And I hope we'll be together in this process. Thank you.
Thank you very much, Edgar. I think noted, again, more of the actors that are involved in helping us, or rather in promoting healthier lifestyle choices. If we think about media, even in addition to creating awareness about NCD burden in Kenya and the importance of healthier lifestyle choices, media also receives money from the private sector to conduct advertisements. So it's not that we see advertisements randomly. We'll see them on KTN before 7 when our children are most likely to be watching. That's when we'll see the advertisements of Coke, and Fanta and the sugar-sweetened beverages. And in the United Kingdom, they've actually passed policies that restrict any advertisements on unhealthy foods and beverages to after 9 p.m. So the assumption being that the young children who would be most easily influenced by those advertisements would be going to sleep by then. So we can see again, like media has roles even beyond creating awareness. Do they have moral roles on when things like advertisements on unhealthy foods are aired? Talking about, I think, the idea of creating grassroots awareness as a role both of government and of civil society is like one of the most critical tap-turning roles that we can play. And so it's quite interesting to know that SANCSA is working with the County First Ladies Association to find channels to create more awareness, you know, on the ground around what is unhealthy food. I can tell you I have had a very long argument with someone about whether Royco is an iron supplement. I'm not sure where this urban legend started. I'm not sure why it has pervaded so quickly, but I can tell you there are people, you will go to the shop or you'll hear, it started because a pregnant woman was talking about how she was told she has an iron deficiency and needs to take supplements, and this lady in the kiosk insisted, alisema, you don't need, hauhitaji kwenda kununua hizo madawa yote, uchukue Royco and you'll get all the iron that you need. I'm not sure whether it's written on the Royco packet, whether this was an advertisement, but the insistence, and the lady was actually quite happy to know that she didn't have to pay the money for iron supplements for 4 months and instead could continually use Royco in her food to get iron. So in fact, the levels of misinformation that we have all around, you know, like we really need to work together, as Edgar has noted, with entities like the media to break down misinformation and share actual accurate information on what healthy diets looks like. Like, what does 5 servings of fruits and vegetables mean? Is it 1 apple, then kamboga tu kiasi, where a half of my plate is meat, a quarter is, or a quarter is ugali or rice, and then the tiniest 1 tablespoon of mboga or of vegetables on the side. Like, what does 5 servings of fruit and vegetable look like? So thank you so much, Edgar, for sharing. I think the multiplicity of roles that we can have as civil society, as non-state actors, both as tap turners and floor moppers. So as I said, we shall have a plenary, but before we get into any questions, so if you have questions virtually or physically, you can start noting them on the chat. But first, I'd like to invite Mheshimiwa just to introduce herself. Everyone actually, we had a round of introductions that you missed, and we're all about equality and equity, so just a chance to introduce yourself and your stake, I guess, in this conversation.
Should I do it from here? It's okay? Good morning, everyone. Okay, so my name is Esther Passaris. I'm the Nairobi County Women Representative, and I'm a member of many caucuses and of 2 committees, public investments and special funds in Parliament. Nutrition is everything. I mean, and well, a healthy nation is a wealthy nation. I think we've had so many discussions on illnesses, and we are what we eat. So for me, I think it's an important topic. It's a topic that you ask yourself, why are you knocking heads to get people to understand that this is an important topic when we consume 3 to 5 times a day, you know? So it's a very important topic. I think we need to find a way to communicate whatever it is we want to achieve in small bites. You know, I look at TikTok right now and I'm thinking that's how our youth communicate. If we can get it right with our youth, right, we can at least save them, right? Save them from the diseases that we couldn't save our parents, you know? Because when I look at my own parents, we've had cancers, we've had diabetes, we've had hypertension, you know? I've had thyroid problems, which I was told it's lack of iodine, So, I mean, there's so many areas that we can work on. So let's try and communicate to 70% of our population, which is the youth, by making sure that our messages resonate with them. And for that, we need to include them to understand that they understand. Because in the era of fast foods, if we are not careful, then we're going to end up in a situation where we can't save the generation that is there right now that is under 35. And that will be a total failure for everyone in this room and everyone that is in leadership, right? And as for the food industry, I mean, I heard you talking about 90% of the deaths. You kept going on. Edgar, where's Edgar? There, Edgar, you kept talking about 90% of the deaths. These masks are crazy, so I was wondering, Edgar's got glasses there. Okay, so you talked about 90% of the deaths. So I was trying to figure out, it's 90%, I wish you had a total breakdown, to show how you came up with that figure, the 90%, in your conversation.
Yeah, the breakdown is available, and we can share in terms of, because Zachary actually presented earlier before you came in terms of the breakdown of various NCDs and the percentage that actually it affects. Right. But then the figure that I was talking about is now the global figure, whereby we have 71% of the global population, which is around 41 million. But then so I did some quick mental math and say, if now we are around 51 million, so 41 million is around 98% of the Kenyan population. If we are losing that, so just giving that.
So you're losing that worldwide?
Yes.
Yeah, so I was trying to relate to that figure, right? So I'll tell you what, so I'm a parliamentarian, and there are many parliamentarians who will join you in and out today. The reason that they'll join you in and out, it's not because they're not taking this topic very serious. Zuleha is our chair for the caucus on nutrition, so we have a caucus on nutrition. We have an SDG caucus as well, which we founded with Ken Okoth. So what I want to tell you is they will come in and go out as their diary allows, because today we've got both morning and afternoon seating. I decided to come here before going into Parliament. But the topic is important, right? And I feel as much as possible, get your MP, your MCAs, and your senators, your governors, your women reps going forward. Now the ones that are there, the ones that will come in 2022, to understand your stake in nutrition, all right, and what you want them to understand so that it can save them and save their constituents and put our country in the right path. Thank you. I took advantage because you never know when I'll be heading out, but I just wanted to set the ball rolling. Thanks.
Thank you, Honorable Passaris. I think you've emphasized something that Edgar noted, which is the role of the youth and the fact that, again, with the youth, we don't want to be floor moppers. We want to be tap turners. You'll hear this analogy a lot. It's an analogy used by Zachariah from the Ministry of Health, Division of Non-Communicable Diseases, where he talks about if there's a tap leaking, do you consistently hire someone to come and mop the floor, or do you actually hire someone to turn the tap so that the water stops leaking? And so the role of the youth, I think, cannot be overemphasized. Even the idea of TikTok, I think a few years ago, before TikTok was the trending thing, you'd find children, the way they play. I'd witnessed my cousins, the way they'd play is they go to each other's houses and then all sit and play computer games or play Fortnite. So they're together, but they're together as they play a game. And so even hearing the amount of screen time that children ought to have versus the amount of screen time that we see children having is vastly divergent. And so the trend of TikTok and having dance challenges where children can learn with their parents. I don't know, if you have a young child, you've probably heard of or seen one of these, the TikTok dance challenges, where a popular song, there's a choreography that you can learn off of the app. And I think it's just a very fun way to get your child moving without the idea of each exercise being boring. So they're learning it and they'll post it on social media, and it'll be a fun way to ensure they're moving more than they would playing video games. So are there lessons we can pick from that? Are there ways we can use social media, we can use platforms that more and more young people are using to actually share information on nutrition and promoting healthy diets. So thank you, I think, to Mheshimiwa, to Edgar, to Zakaria. I think they've given us a grim picture, but one that was sorely needed for all of us to understand as a background before we move on with this conversation. So I'd just like to open up the floor to any questions, clarifications. In terms of the presentations, I think we'll try to coordinate with all the facilitators to ensure we actually have copies of our presentations and share with them and share them with all of you after. But for now, any questions? I can see some of the physical participants have some. For the virtual participants, you can note on the chat or use the raise hand function. So let's start from there.
Thank you very much. My name is Stephen Anguva, the National Coordinator Network of TB Champions. I have a question and a comment. My comment is from all the presenters, I've seen that a lot of policies and guidelines are geared toward children. So in the community, we are thinking, we have that notion that nutrition is all about children and that interventions always go toward children. And that's why when I saw the presentation on the target, how the country is doing, I've noticed that in terms of children, we are doing much better, but adults, we are not doing good. So I think it's high time we bring in interventions in terms of taking nutrition as a responsibility of everybody, and also healthcare providers. They need to take it as an initiative of ensuring that they're empowering everybody from the children to the adults, because the level of obesity that I've seen is worrying. That is my comment. And on the question is about the front of package labeling, I've noticed from one speaker that said that there is a law that is still in progress. So I think we would like from this sitting to get an update in terms of the status update. How far are we with that, so that we know where we start advocating. Thank you.
Thank you, Steve. Yes, Peter.
Okay, thank you for the presenters. My question goes to Honorable Parasfaris. There's a bill which was sponsored by Dr. Bukose on food and drugs. How is it going to leverage on the conversation we are having today?
Okay. What's your name and where do you come from? Okay, I don't know what NEFAC is. Can you explain it to me? Okay. Now, you're aware of the bill, okay? Parliament, let me tell you how Parliament works. There are many, many bills that come to the floor of the House. And unless you have a deliberate interest on it and you end up catching it when you're in Parliament, right, sometimes you miss it, right? So I have no idea at what stage the bill is at. And the most important thing would be maybe for us to try and get a copy of the bill, find out, I could do that right now, I could call the table office, find out where the status of the bill is. But have you perused the bill and have you engaged the mover on the bill? And do you have any issues on the bill? Because we go, do you know how laws are made and how the bills are passed? All right, so you go through the first reading where the topic or the bill is introduced. Then you go through the second reading where people can make a contribution, right? And then when it passes that stage, it goes to the third reading, which is the Committee of the Whole House, where people have actually sent in amendments, right? Then when the Committee of the Whole House does the amendments, and of course it will go to see whether it's a money bill, which requires the government to put in some resources. And at the moment, almost every money bill, unless it's being pushed by government, is shelved. Because we're high in debt, we don't have money. So your question, tell me.
I was asking, how is it going to leverage on the conversation we are having today?
Okay, so the thing is, I cannot answer that question, and I cannot pretend to know how to answer that question. You have you see, this is where I say citizens have got to be well versed about everything that's going on in Parliament. Our sittings are public, they're open. they're available to everyone. Have you read the bill yourself? Because I haven't read it, so I can't tell you how it's going to leverage, and I don't understand what kind of leverage you're looking at. And you know, I want to tell you, and I say this to all Kenyans, just because I'm elected Mheshimiwa doesn't mean I have all the answers to every question and problem that you might have now and in the future and past. You know, we're just human, just like you. I wear many hats, and one of the hats that I wear, in spite of the fact that I sit in Parliament, is a citizen just like you, and a person of concern just like you, right? So because you represent a people, you're a leader in your own right, and you have an organization, right? And you have specific concerns regarding food, drugs, and persons living with HIV, right? So you must have a legal advisor, all right? Or you could actually try and, you know, if you send a petition at Parliament, or if you send a question at Parliament, you could actually write a letter to Parliament through the clerk on this specific bill, the question that you're asking right now, because if I give you an answer right now, I'm misleading you. And I don't want to mislead you. I want you to get the answer that you seek, but you have to also understand the question that you want answered. And before you can actually engage on the bill, you have to read it. If you can't understand it, then you can actually ask for somebody who can help you understand what exactly, because let me tell you, sometimes I read these laws and I'm lost. I don't even understand what the heck are they trying to achieve. Why can't you just put it in black and white? But you know, it's a whole booklet of things, and sometimes you might think it actually means this, and it means another, all right? So all I want you to understand is if you want to know anything about anything that concerns you, get involved. Get involved. Yeah. I don't think you'll meet any Mheshimiwa except the mover of that bill who probably understands it better, but you will find maybe he's moving it because somebody from civil society is pushing him to move it. Ye mwenyewe hata hajaisoma. And a ride wave peke yake. No, I'm serious. I'm telling you the truth. You know, I'm telling you the truth. Sometimes you're given a bill because civil society is pushing it. Na mwenyewe hujasoma the whole thing because it's so busy. It's so busy, all right? And there's so much going on. But I want you to tell me, just write it on a piece of paper, whichever bill you think it is. I'll engage table office, and before I leave, I'll let you know what state it's at, all right? And if you have specific questions, then you can channel them through Edgar or Gaines, yeah? Okay. But just give me the name of the bill, then I can find out what is the status of the bill right now. But I cannot tell you how it relates to your organization and what it means for your organization unless you go to the specific. And only you can be able to identify that by actually perusing the bill. So if I can get a copy right now, I can share it and you can have it. Have you seen the bill yourself? So you haven't seen the physical bill? Okay, so I'm going to try. Just give me the name right now. Give me the name right now, and I'll try and get you the physical bill. And I'm sure probably Edgar also has the physical bill. Do you have it? Edgar? Just give me the bill right now. Just write it down, and we try and solve that problem because I believe in doing things at that spine moment. Huh? Thank you.
So we're witnessing already actionable things coming. An opportunity has been brought up in terms of the ongoing discussions on food and drug regulation bill and how we can leverage on this conversation on nutritional labeling and promoting healthy diets, and what role the stakeholders within the room can actually play to contribute to that bill. You know, haba na haba, is there small or low-hanging fruit that we can actually target within this bill? And so already a commitment to get access a physical copy of the bill that participants can then peruse through and perhaps discuss, perhaps through Sun CSA due to its pre-existing connections, whether there are civil society or non-state actor perspectives that ought to be included within the bill. So thank you for that. I think I'll take, before I take a second round of questions and go through some of the comments on the chat, I'll just give Zachariah or any representative from the ministry to answer Steve's question in terms of the progress on developing front of pack labeling regulation. So perhaps you could give what the process is to develop such regulations and where we are as a country within that process. So Zachariah, I don't know if you can take that question. I think Zachariah has dropped out. I know we have Immaculate in the room, but I'll just give her a few minutes to settle before she can come and comment on Steve's question. So I'll just take a second round. I think first we can go through some of the comments noted on the chat, then we shall go to Edgar. I think someone had raised their hand on this table. Yeah. So on the chat, we have Burnett noting, the society going in for Roico cubes means they understand the importance of iron. So the gap in information is actually nutritionists need to ensure that society understands the food commodities that need to be consumed to get iron. So labeling on food commodities needs to be correct. And I think that's a true and accurate reflection. We may want to get these micronutrients, but we don't actually know what the most effective form of food or of beverage is for us to get that. So thank you, Burnett. So a question from Mary, for the countries that have restricted advertising of unhealthy foods during peak hours, what are some of the anticipated challenges considering that media houses have to maximize profits? Are there any incentives the government can extend to media houses to encourage compliance? So thank you for that question, Mary. It's very, I think, reflective of the broader discussions that we have under Global Recap. It may not be the substance of this meeting today, but perhaps we could get some reflections maybe from Dr. Oti or any of our WHO or IDLO colleagues on how restrictions on marketing have worked out in other countries and what the pushback has been from media houses, because again, as Mary has reflected, it really is about profits. So Celine from ILA, which is International Institute on Legislative Affairs, has noted that she has seen the bill. It was championed by Honorable Dr. Pukose and has had a number of challenges, including delays in Parliament. Another gap has been around stakeholder engagement, considering the bill seeks to regulate under one roof several thematic issues that already have individual laws. So Celine Awor from ILA, also a potential collaborator in terms of accessing the bill and seeing improved stakeholder engagement on the contents of the bill. So I'll just give a chance to Edgar and the lady over here to give their questions. I'm sorry, I do not remember your name. To give their questions, then we can turn it over to our colleagues and facilitators to provide some responses.
Yeah, thank you so much. So mine is not really a question or a comment, but to address what Stephen was actually asking about in terms of why do we only target children? And there's something we call the first 1,000 days. And I'll give you the reason why it's really critical. Because the first 1,000 days is the period between conception up to when the child turns 2 years. And when you look at the growth milestones, why is it that it's really critical for children? For example, if a child is stunted, stunting as one component of malnutrition, if a child is stunted before they turn 2 years, it means that the damage that has been done is repairable. So the child will remain with those with the damage for life. So we have damage to the brain, and normally we do this, it's almost a half day in terms of having this conversation. So we have damage to the brain, we have growth milestones that are really damaged, and also we have in terms of this child being able to reach their full potential. So if at all we don't have optimal nutrition within the first 1,000 days, then it means that this is a child that will not reach their full potential. So what do we mean by full potential? Is that if this child was, in terms of fate, this child would have been a president, then they'll not be able to do that. If at all, they will be able to perform very well in school, but because of the damage within the first 1,000 days, then that will not be realized. But that does not mean that we only target children. You look at the most vulnerable. So the most vulnerable group is one, the children. And then number two, we also have got pregnant and lactating women that also we have nutrition interventions for, because they're also vulnerable. We also have got the adolescents, so they're also adolescent nutrition and adolescents programming. But then also we have the geriatrics, the elderly, that also we take care of. And when Madam Veronica was talking, she mentioned about the Kenya Nutrition Action Plan. So when you look at that Nutrition Action Plan, it targets the whole life cycle approach, so that we have nutrition in the whole life cycle. It's just that we didn't have an opportunity to present about nutrition. But if you go to nutrition related events, you'll see and you'll better understand the categorization and also the interventions, because there are interventions that target different growth milestones and also different age groups. And I know Immaculate will also need to add on that. So I mean, the target is not just for children, but it's because of that critical age that we actually lay emphasis, so that we are able to arrest any kind of developmental milestones before the 2 years. Yeah.
Thank you. Good morning. I didn't introduce myself. My name is Immaculate Nyaugo. I work with the Ministry of Health at the Division of Nutrition. So the discussion which is ongoing, and if I can borrow from the analogy, if we treat or if we care for the children, we are turning off the tap. The children are very vulnerable and they don't take care of themselves. So that is where intervention starts. If we don't do that, then we are not going to be there. I'm a nutritionist for the last 28 years, but you give me an adult with malnutrition, I will really shy off, because it will be expensive, it will be difficult to take care of. But you give me a child, I will be able to do it quickly and very fast. So that is why the Ministry of Health actually treats children in public hospitals for free. Because one, it is cost effective, the government is able to manage. Secondly, it is the best intervention that the government can take responsibility of. You grow to be adults, you take your responsibility. You tell a child not to eat sweets, they will always remember. You tell adults not to eat these sweets on the table, you will still eat it. So I think taking care of nutrition issues of children, that is the best. Can I go to the second question about the status of front of pack labeling? I think the officer who has asked the question is going ahead. I'm hoping that your presentation is coming and that question will be sorted out in that. So can we pack it a bit?
Yes. So
okay, thank
Steve, just park that question, and you can see after we go through perhaps the subsequent sessions whether you feel that the question has been adequately answered. I think there's an understanding in general in health around the importance of treating early childhood or having health interventions within early childhood. In fact, in terms of the right to health, legally speaking, the right to health is defined as a progressive right or progressively realizable, which means that governments can just take steps to the maximum availability of resources that they have to realize the right to health for adults. But for children, the right to health is actually immediate because of that recognition of the preventive. It's the same rationale as primary health care. preventive action is more sustainable than curative interventions. But I also do understand Steve's concern, because I'd say young adults, especially in urbanized areas, and as we heard from Zachariah's presentation, urbanization is steadily becoming the way of life in Kenya, that there is this population with very unhealthy alcohol consumption and very unhealthy diets. So the ones who get KFC post 10 p.m., my age group, we are very many, or who go on a night of binge drinking and then finish the night off at Chicken Inn or Pizza Inn. And there are many, or pre-pandemic, there were many restaurants that would be open 24 hours on Thursdays, Fridays, and Saturdays, specifically to target people who've come from binge drinking, and to add onto that by eating, the Chicken Inn or the Pizza Inns or the KFCs. And so perhaps that is also another facet that youth representatives can think about. How do we reach this specific demographic of the young adults? Yeah. So I can see Sam has shared on the chat, and this is connected to Mary's question on restrictions on marketing and the challenges any anticipated challenges, considering media houses have to maximize profits. So within the chat on the Zoom platform, Sam has shared a link to an article that talks about success of restrictions of marketing to children in Chile.
If I may.
Yes, you may.
Sorry, yeah, so I don't know if you can see my screen. So just a demonstration of what the restriction of marketing, one aspect of it in Chile. So you can see on the left-hand side that there's this box of I think it's cereal. And you can see very clearly, this was before the law was passed on restriction of marketing to children. And you can see this very entertaining cartoon character that they've used to attract the attention of kids. But after the law was passed in Chile, you now move to the right-hand side, and you can see that the industry has had to take away these characters that attract children. And in addition, you see some, I think, these hexagons at the top right. These are saying high in sugar and high in calories. So that's their own version of the front of package labeling. And it's been, so far, it's been found to be quite effective. So just a side note there. Thank you.
Thank you, Sam. I think that's actually a very good reflection of how marketing of certain unhealthy foods is done for children. And we can think about the Crackles packets. There was a time they had a rebranding campaign where instead of the usual crackles are that packet of crisps, instead of the bland color, they'd have some that have cartoon characters at the top, or Marvel superheroes that were very attractive to the eye, and you could just see children's eyes as they entered the supermarket, and they were very strategically placed because it was a promotion. So as they enter the supermarket, their eyes just directly go to that picture of Iron Man that's connected to a packet of crisps. So Mary, I think this is also a chance to shamelessly plug in, as we say, Kellin's work. So within the next few months, we shall have another similar forum that will focus solely now on restrictions on marketing. And so these are some good questions or considerations that we can take into account as we move into that. So Mary, we shall be sure to include you within the list of participants for that next sensitization. So if there are any other questions, yes, I see one there.
Okay, mine is not a question. I had raised my hand earlier. I wanted to respond to another question that had been raised. So my name is Dr. Mary Mwale. I'm from Ministry of Agriculture. I'm a nutritionist and very much involved in the National Food and Nutrition Security Policy, the KFDA bill, and also the Food Safety Bill. So currently what is going on, the KFDA bill was recently discussed in Parliament. So within this month, you can check. And then it's work in progress. But now the government, the Ministry of Agriculture and Health, are spearheading the food safety bill now. A decision has been made to separate drugs from food. So now the government is fronting the food safety bill, and at the moment there is the public consultations that are going on. So that's just to give you information. And then on the other issue of why we have had so much focus on children and not adults, just to add on what Immaculate had said, when you start early, most of the metabolic diseases begin early in life. So when you start early with the children, you set the pace for a healthier individual in future. So we are trying to save the current the young people who will be future adults, and then we also now begin to focus on the adults to correct the problems that began early in life. So it is important to note that it's not just tackling the problem at the adulthood level. You have to begin early, even from what the mother eats when she's pregnant, up to how the child is raised. So I think it's important to note that, and that is what we shall, most of the policies and the strategies we are implementing are meant to achieve. Thank you.
Thank you very much, Dr. Mwale. I now know your name. So I think thank you everyone for your attention, I'm starting to see some passion, some understanding of why this is such a necessary topic to have an honest conversation about. And so we're already seeing certain things or certain opportunities that stakeholders in the room can take advantage of, namely the upcoming food safety bill. As it is undergoing through public consultations, perhaps there is an opportunity for all of us here, whether through a coordinated or collaborative effort, to actually access the bill and give, that sort of memorandum in terms of the civil society thoughts on the food safety bill. I think that's a great opportunity that's been noted, and we shall perhaps find a way to follow up with it, Dr. Mwale. So we'll go into a short break right now. It's 11:05. We'll come back in at 11:30, where we'll sit down and discuss technicality of what nutritional labeling is and what specifically front of pack labeling is. I think we have already seen a bit of an example from Dr. Oti, but we'll have Dr. Hannah Bekele from WHO to actually come in and give us the technical perspective of front of pack labeling. So let's all be back and seated at 11:30. Tea is served right out here. As Edgar encouraged us, we can also be tap turners in our own lives. So the fruits, perhaps the amount of sugar we put in the tea, we can start, slow steps for all of us. So thank you all for listening. Tea is right outside here.